So let's look at two new drugs for subcutaneous administration, the infliximab sub-Q. And there are two doses for this drug, 120 milligrams if you're 70 kilos or less, and 240 milligrams if you're heavier than that. So let's take a 70 kilogram patient and give them that 120 milligram dose given every 2 weeks. And typically for subcutaneous administration, the trough concentrations are quite high, normally close to 20. And that may be sometimes causing some myalgia or fatigue. And it's also, of course, an immune suppressant, so you may want to bring that down a bit this time to go to a target concentration of 10. We'll hit the calculate button. And you can see for this subject, 120 milligrams, you can actually give it every 3 weeks to get to the trough that you want. If you're giving 240, then you've got about 4 weeks. And you can see that it does take some time for the patient to come from where they were to where you want them to go. So if you take a trough on the following dose, they're not going to be quite there. But again, if you use your mouse, you can see what the trough concentration would be. If you took it a little bit earlier, you're on your way down. And then again, you get the same probability curves. Again, because your concentrations are up high, you've got a relatively slow clearance. So this patient has a very low probability of developing anti-drug antibodies and a relatively high probability of mucosal healing and of CRP normalization. So this might be, for example, a patient that you can spend a little bit less time being concerned about.